I'm Jenna.
Hello, I'm Gloria.
We are Worthy Wellness
because we are worth it.
Our purpose is to introduce women entrepreneurs, products, and services while proceeds help women in need for holistic care and therapy services.
Welcome, ladies.
Good morning, everyone. Thank you again. We have another episode of Worthy Wellness. And today we have our sponsor, Dr. Mary Tobin from Tobin Holistic Medicine. And our episode today is going to be in regards to thyroid.
Yes, I'm super excited.
Oh,
and
good.
So many people there's so much misinformation out there about the thyroid. And a lot of times women will come in and they'll go, I know something's wrong and I think it's my thyroid and yet I've been tested and my doctor says everything's fine. And I can't tell you how many times I hear that. So I'm so excited to be doing this episode.
Great. Well, we're excited as well to have you again as our sponsor for Tobin Holistic Medicine. And I just want to preface that Dr. Tobin will be once a month on our podcast to talk about certain topics. So today, like I said, it's going to be on thyroid. So Dr. Tobin, here's question number one. Are you ready?
Question number one.
I know, right? What is thyroid and its function?
Okay, so your thyroid is a little gland. It sits in your throat, and it's got it almost looks like a bone shape. It's in your throat.
Okay.
And it's one of your major glands. What it does is it produces thyroid hormones. And why that's important is every cell in your body really needs that thyroid hormone. It helps with so many different functions. It helps balance out your hormones. It helps with your growth. I mean, it just does so many functions. And because it's in your throat, it's very sensitive to certain things. Like, for example, will pick up radiation very, very readily. So it's a delicate gland. But I want to talk a little bit about how it's on a feedback loop with other things. And so a lot of times when those people are coming in and they're like, there's something wrong with my thyroid, and it's been tested and everything's fine, and yet I still don't feel well, they know something's wrong. And sometimes things get blamed on the thyroid that's not really the thyroid's fault too. And so there's a lot of times underlying things that really are triggering what's causing the thyroid. So when you say what is the thyroid gland, I'm going to talk about how people know that there's a problem with that, the symptoms they might have. So some of the symptoms they might have would be, ones commonly people know are things like weight gain, because your metabolism slows down, cold hands and feet, brain fog, the brain just doesn't quite work, outer parts of the eyebrows thinning. Those are common, but then there's also muscle aches, extreme fatigue, joint problems, a lot of what would even be construed, constipation is a very common one. A lot of things that might even be construed as like fibromyalgia are also your thyroid not working very well.
Oh.
So all of it's kind of a combination. So there's so many things symptoms that show up that people are like, well, could be anything. And if my thyroid got tested and it was fine, then it must be one of these other things. So that's why I want to talk a little bit about the testing and also the other things that are involved with thyroid hormone. So the one thing from a testing standpoint, and if I'm rambling on and you want to stop me and say, no, I want you to answer this instead, just stop me, okay?
No problem. Well, that's my next question was going to be, when testing for an imbalance, what do you request? What do you test for?
Okay.
So go right ahead.
Okay,
We're
thank
right
you.
on point.
Okay, so from a testing standpoint, oftentimes when somebody goes just to their primary care doctor, they'll check TSH, thyroid stimulating hormone, and if that's in range, then that's their gold standard. They go, nope, there's nothing wrong with your thyroid. Here's the problem with that test. When they talk about it being within lab range, that doesn't necessarily mean healthy range. So lab range means the lab, everybody who's having that test done at the lab throws that number into a little hopper, creates a bell curve and throws out the upper and lower portion of that bell curve. And now that center of that bell curve, this is our lab range. The problem is a lot of people that are having their thyroid testing done on a routine basis because they're on thyroid hormone, they're on thyroid hormone. So that's going to skew those results. So lab range and functional healthy range are not the same. So oftentimes I'd ask people to go ahead and pull up their lab report, the actual report, and look and see where their TSH was. Oftentimes it's like 0.6, 0.7. It's at the very, very, very bottom end of lab range, whereas the minimum functional I like to see is 1.8. So somewhere 1.8 to 4.3, 4 point something is a good functional range. Whereas the lab range brings you already all the way down, depending on the lab, to like say 0.4 or 0.5 or something like that, which is not a good functional range. So that's the one thing. And then sometimes when they do check the TSH and say it's off, they go, oh, well, the only real treatment we might give you might be to give you some thyroid hormone replacement. So we're going to give you levothyroxine or Synthroid or something like that as a replacement for what your thyroid's not doing. And that's the conventional standard approach. The problem with that is that you're giving somebody a hormone, you haven't really resolved what's the root of the problem. Why isn't the body producing it? Because the thyroid operates on a complete feedback system. And so if you're just interjecting something foreign to replace that hormone, it messes that whole feedback loop up. And the reason the body has feedback loops is because when you need a little more of something, it can give the signal, hey, I need some more of this. Oh, I don't need so much. And the body can respond. When you're just taking it at a particular time, a specific amount, your body may need more or less at any given time. And so you can't adjust for that.
Right.
So that's the one issue with what they're missing. The other thing, so that tells me, kind of how you want to have the testing. So when I have somebody tested for thyroid hormone, I will check TSH, but I will also check T3 and T4, which are two thyroid hormones that the thyroid produces. And then I'm going to check something called free T3 and free T4. The difference is T3 and T4 are bound to a molecule. So they're too big to fit into the receptor sites. So they have to be freed from that molecule to be able to fit into the receptor sites. And so if you check how much is there and how much is freed, because you could have a ton there and have it not being able to be freed, so it still can't get into the receptor sites. So I'll check all four of those. And then I will also check the thyroid antibodies. And so what that's doing is it's looking to see if the body has created an antibody to some of the thyroid tissue. And if that's the case, then you would know you have an autoimmune issue that you're actually working with. And about 80-85% of hypothyroid, where your thyroid's low functioning, is actually an autoimmune issue. And so that's where, from a conventional medicine standpoint, we don't do anything with autoimmune diseases other than just, give you the hormone replacement or maybe do something to suppress your immune system. But there's nothing that can really be done for an autoimmune issue. So your medical doctor, unless you're seeing a really good quality endocrinologist, is not generally going to go down the pathway and see, is it really autoimmune? And so the autoimmune titles are, if you've ever heard these, ladies, Hashimoto's is hypothyroid, meaning underactive thyroid, and Graves' disease is hyperactive thyroid. So the symptoms I gave earlier were more hypothyroidism, which is Hashimoto's when it's autoimmune, because those are the very common ones. But Graves' disease, which is also a thyroid autoimmune issue, because it's hyper, it's got different symptoms. It's got the opposite symptoms. So there, somebody's got too much energy, they feel antsy and jittery, they tend to lose weight, and people are oftentimes like, oh, give me that, I can use that, that's good, but it's not good. One of the other symptoms it has is problems with the eyes, especially creating where your eyes appear to be kind of like protruding. And oftentimes if that happens, it's not always reversible. So it's not something you don't really want, Graves' disease or hyperthyroid, even though some of the symptoms sound like, yeah, that'd be great. I could use that. Having your thyroid operate perfectly is really what you want.
Wow. And so that was a lot of great, and of course, I'm kind of going through my checklist in my head, because you're like my WebMD. So, question. So, what are the examples of treatments, or how do you, when your patients come in?
Well, and so what I do from a holistic standpoint is I'm looking to see what's the real underlying root of it. So when I talk about it being on a feedback loop, so picture in your brain you've got neurotransmitters, and a lot of people have heard of dopamine and serotonin. Those are kind of those feel-good neurotransmitters. They're kind of the beginning of that feedback loop. Remember how I said, maybe I didn't say, one of the symptoms of hypothyroidism is also depression. So in your brain, you've got those your dopamine and your serotonin levels, and they send the signal over to your hypothalamus, and then your hypothalamus sends the signal down to your pituitary. And then your pituitary is actually the gland that releases that TSH, or that thyroid stimulating hormone. And then that tells your thyroid to produce its T3 and its T4. The thing is that your body produces about 7% T3. Now that conversion takes place, and this is where, when I start looking at the root of the problem, where I usually find a lot of the problems, because 60% of that conversion takes place in your liver. So when somebody has an overworked liver, they aren't going to be converting their T4 to T3. So that will cause a problem right there. And so many people in today's society have their liver. I can't tell you how many people have never done a liver detox. And we just don't live in a society that you can get by without doing a liver cleanse periodically, unless you eat super clean and you have very little stress in your life, because stress directly impacts your liver as well. So then I'll say, let's start with doing a liver cleanse and see if some of that conversion takes place. Okay. And then, just so you know, about 20%, because it's a very delicate balance, of that conversion goes into what's called reverse T3, and it just kind of keeps it from having too much. So oftentimes when I do the testing, I might also ask for that reverse T3 level and see what that's at. And then if you need a little bit more, 20% more can be converted from T4 to T3 in your gut. So a lot of times people that have liver problems also have gut absorption issues, maybe leaky gut, inflammation, bloating, and things like that. And so then they're also not getting that 20%. So you see how oftentimes, if it's not really a thyroid problem, it's one of the underlying problems. So when I'm going to treat, I'm saying, okay, let's work on these. Now, oftentimes, if somebody has another autoimmune issue, or just doing this isn't resolving it, or I suspect autoimmune thyroid, I may already know, if I've done the blood work to see if the antibodies are there, that then it's an autoimmune issue. So then we will deal with it as if it's an autoimmune problem. I will also still work with the liver and gut, because those are critical for any autoimmune issue. So the treatment is always very individualized, depending on what this person's underlying issue is. And if they're on medication, oftentimes they can start backing off their medication, or they'll find that the medication wasn't really working or helping me anyway. And so, I don't tell people to stop their medications. That's not my scope of practice. But I will refer them back to whoever the prescribing physician was, and talk about, okay, let's relook at this. This is my new labs. What do we want to do here? Things like that.
I love that. I love the fact that you're really getting to the root of the problem, literally, and taking that step, where I know a lot of endocrinologists won't do that, can't do that for whatever reason.
Well, and it's become an unfortunate truth that there are physicians out there, very good primary care physicians, that would very happily run all this blood work, but they are very much restricted on staying in the rails with what they're doing. Right. And so they can refer out to an endocrinologist for this, but the insurance company is going to give them some flack if they start ordering labs that are not really in their scope. In their scope, this is outside of a primary care scope from an insurance standpoint. They're totally capable of doing it and they totally understand it, but we've become very specialized in our medicine, and so people are kind of parted out. And that's one of the major reasons I love holistic care, because it's looking at the body as a whole versus each individual little slice. And when you're just looking at a slice of the body, you kind of miss the overall picture.
Right. No,
So I think that's amazing that you really broke down the testing, what the difference is between the thyroid and the antibodies, and how there's the differences between prescription, finding the underlying cause, and then there's a way to wean off of it. So what does that look like if a patient comes to you and they're on prescription medicine and they want to wean off and go the holistic route? What does that prognosis look like?
So what that looks like is sitting down, reviewing any labs that they've recently had done, maybe doing some additional labs, doing a consultation and actually seeing what does it look like is really going on with this person. Like, for example, I was talking with someone and they were saying that immediately after some major event, it can be childbirth, it can be a toxic exposure, it can be any type of thing that that's a shock to the system, will throw the hormones off, and that can actually kind of trigger autoimmune issues. And so oftentimes what we see is when somebody started noticing there was a problem, there was something that happened. And then you're living your life, you don't necessarily have severe symptoms. This isn't, and as it has progressed, they find out, oh well, I had this, I now have autoimmune thyroid or something like that. And so the triggering event can actually create the body to be stressed enough that it will create the autoimmune condition. Autoimmune conditions seem to be triggered by something where the body starts getting the signals saying, oh, the body's tissue is bad. It actually tags the body's tissue and says this is bad. Now, every time it gets flared up, it starts attacking that tissue. So you can never actually cure an autoimmune disease in that you can never untag something. But you can definitely get it so that the person doesn't have any symptoms and they're not having flare-ups, or give them tools to work with and knowledge on their own system so that they know, okay, if, for example, if I also find that I have an allergy to gluten, I know if I eat gluten, whatever my autoimmune issue is, it's going to flare up. So now that I have that knowledge, I can say, oh, if I want to have a piece of cake, I can expect to have a problem after I have my piece of cake. I'm just making an informed decision. I'm going to have my cake anyway. That's fine, but that's an informed decision. So that's a lot of the treatment, is giving the patient the knowledge, figuring out what the root cause of it is. So it involves doing a consultation, and then I do really in-depth evaluations to kind of identify the root of the problem. And then we do some different treatment protocols and judge, how is this working, how's this working, and find the right path for each individual person.
Great. So then it sounds like they have ongoing assessments, these testings, to capture their baseline and to figure out their progress if they're choosing to wean off the prescription and going holistically. The test is going to kind of determine how the body is adjusting and what is effective. So it's kind of ongoing testing, would you say?
Exactly, because for example, if somebody has we don't know until we work with somebody how much their body's going to completely resolve the situation. Some people, they get to the point where they're like, wow, I don't even need medication. Some people always have to have some medication. Everybody's different. So if somebody has had a lot of damage from autoimmune thyroid, you're probably going to need some thyroid support. And yet I have people that the only thyroid support they need is some extra nutrients and and some other things like that. So everybody's different. I would never say everybody could get off thyroid medication. I would never say no one can get off thyroid medication. It's on a complete spectrum, and it's very individualized.
So, what if you are a patient who has an antibody, or you're like on this borderline where it's not extreme and you need a prescription? Is there a way to prevent, or say they don't have the belief of going down that route, that they could choose not to take the medicine because they're in that beginning, I guess, borderline stage, or that antibody point? I mean, personally, that's where I'm at. So my family has thyroid. There's some family members that have hyperthyroidism, and there's other family members that have hypothyroidism. So I'm not really sure if it's hereditary, but me personally, I'm trying to prevent taking medicine. And when I get tested, sometimes it will show Hashimoto's, and then sometimes it says I'm not. So I don't want to full blown, be going into the medicine route. If there's a way I could find that underlying cause, or prevent from going in that route of being dependent on medicine like some of my family's members were. So can you clarify if it's hereditary, and then is there a way to prevent, blowing over to be severe, I guess you would say?
Wow, I am so glad to be, and you're the perfect person to ask that question, because that's the perfect time to catch somebody. So in other words, because sometimes you do test that the antibodies are present and sometimes not. What that means is, when you're doing something that's flaring up the system, so then the antibody level comes up higher when you're all flared up. They will show up when you're operating and your body's operating very well. You don't have a lot of inflammation. You're not flared up. Then those antibody levels come down. So the beauty is you can have everything operating at the point where those antibodies are not flared up. So you are the perfect candidate to say, oh, if I figure out exactly what flares me up, and then I make the conscious decision to do the things, whether it's detoxing or taking extra nutrition or avoiding certain foods or what have you, if I make the conscious choice to do those, I can prevent having full-blown Hashimoto's or Graves' disease. And the difference between those two is, in other words, it's not uncommon that somebody will have, like, for example, Graves' disease, hyperthyroid that turns into hypothyroid, or we'll do a treatment for hyperthyroid that will cause hypothyroid. It's really the same thing. It's just whether it's overactive or underactive. One of the misnomers when we do testing, especially blood work, is we only do blood work so often. And so we have a tendency to think, okay, if my level was at a 2 in January and it's at a 3 in March, then I must have gradually gone up. But when they've done actual daily TSH testing on people that have autoimmune thyroid, the TSH jumps all over from day to day. It could be 7 one day, 1 one day, 5 one day, 0.5 one day. It jumps all over the place. Whereas when we look at our lab results, we tend to think, oh, it's just been on a continuum. Not necessarily so. If the person is having a lot of activity, it can be all over the place. So that's one of the misnomers with looking at your lab results. But so I wanted to, you also mentioned something about it being hereditary. So it's not hereditary in that it's not like a genetic defect, but you can have predispositions for it. And a lot of times what I see in all kinds of health issues are the predispositions are actually lifestyle factors that family was raised with. I've seen families that all have a certain health issue. Well, they were raised in an area that there was a lot of chemical toxic exposure, or, so sometimes it's environmental that comes out looking like it was genetic, but it really is not necessarily a genetic defect that they're born with. you definitely can have predispositions for things, and sometimes it's lifestyle, environmental, sometimes it is actually genetic. But thyroid disease is not really a genetic thing as much as it is, it's very, very, very prevalent. And I mentioned your thyroid's very sensitive to certain things. So, your thyroid needs iodine to function. I mean, that's one of the chemicals or one of the supplements or the nutritional items that it actually needs. So, if you don't have any iodine in your diet at all, your thyroid can't function. But if you don't have enough iodine and you have a radiation exposure, for example, then your thyroid will just suck up that radiation. So radiation is very exposure is very your thyroid's very vulnerable to that. So if you can, when you're doing, I always make real careful. This is a sideline, but when you're having any type of X-rays done, make sure that they give you that collar to cover your thyroid, because they won't give it to you if you don't ask for it. But you want that collar when you're having any type of X-rays done to cover your thyroid. Just thought I'd throw that out there, a little side issue.
That's great.
Okay.
I love that. I love that.
Thank you so much for this very complex topic. I think the greatest thing, listeners, is that we do have a timestamp and we do have a transcript. So I know that was an earful and there was a lot of points being said. So you can have a look at that transcript and that timestamp that's really relevant to maybe your personal question or clarity that you need. And we pretty much touched on the 6 points. So I could do a recap, or Gloria can, but is there anything else that you wanted to mention before we do that recap, Dr. Tobin?
We may want to do thyroid again. There is just so much involved with the thyroid, and there's so many questions that people have. Like, I don't even know if I really completely answered your question. So I would love to do thyroid again sometime too. And people may be able to submit questions.
Right. I think even probably when we do one of our workshops, that may be one of the topics, and our listeners can reach out to us. If they have any questions, they can direct message us if they have any specific questions. But of course, we would really want our listeners to, set up a consultation with Dr. Tobin. If you have thyroid issues, if you're being told that you have thyroid issues, if you know someone or someone in your family and you've got some questions, I think setting up a consultation with Dr. Tobin to come in and talk to her, get to know her, and then she can start the process. I know it's in my family, on my sister's side, she's the only one out of all of us kids that have had any issues with that, as far as we know. But I think this is a great, again, a really big topic for a lot of people.
And if someone has, and they don't live in the area, and they would like to do like a Zoom consultation, all they would need to do is send in their lab work, and I can still do testing with them and do a Zoom consultation with them online as well.
Oh, that's great. That's really good. I like that a lot. Jenna, you want to go ahead and do the recap?
Okay, sounds good. So, as mentioned before with Dr. Tobin, you are able to do a Zoom consultation. You can also visit her at her office. Everything is all customized to the individual. We are very unique human beings, and that's the best route to start, is with that consultation. So the 6 points, the first one, she touched on the thyroid and its function. The second is, what are the testing to request for if you have an imbalance of your thyroid. The third point are examples of treatments. Fourth is, what type of prescription medicine, or can you have a holistic approach, what the differences are and how to go about it. The fifth point is thyroid hereditary? And lastly, how do you prevent thyroid conditions and those environmental factors that you mentioned? So we are definitely open for questions, listeners. You can always message us directly on our IG account at Worthy Wellness Inc. INC, or Dr. Mary Tobin is going to mention her contact details, and you can feel free to reach out to her directly as well. Would you like to say your contact details again, Dr. Tobin?
Sure, I would love to. So the email address, or excuse me, the website is Tobin, T-O-B as in boy, I-N, holistic, Holistic, medicine.com. And you can also call the office. The office direct line is 714-256-2287. And they will be able to help you and get you all set up and whatever you need. I'm just looking forward to working with you.
Right. And then I'm going to go ahead and mention her IG account,
That'd be great.
which is Tobin Holistic Med, Tobin, like Nancy, Holistic, Holistic, like cat, Med, Tobin Holistic Med. And that's on her IG account. So you can also contact the office through that. We are just honored again to have Dr. Tobin as one of our main sponsors for Worthy Wellness. We look forward to a lot of workshops that we're going to be having with her. Her book is coming out soon,
Yes.
so we're going to do a big to-do for that as well. Again, listeners, thank you so much for listening, Dr. Tobin.
Thank you.
You
This is
were
so
wonderful.
much fun, and thank you guys all for coming and joining us. We really appreciate it.
Thank you, everyone.
Thank you. Have a blessed day.
Have a blessed day, everyone. Thank you again.
If you're also a woman entrepreneur to support our cause and would like to be considered on this podcast, please reach out to us. We would love to connect. We see you. We want to connect, empower, and inspire others. So please call or text or even fax 949-793-8781, or our Instagram is Worthy Wellness Inc., like INC. Hope to hear from you, and thank you for listening.